I'm Mila Marhevich. I'm one of the owners here, and today we have a guest speaker, Dr. Teresa Spano, and she's a nutritionist with Southwest Florida Integrative Medicine. And we look forward to your lecture today, learning about the do's and the don'ts with osteoporosis when it comes to nutrition.
Thank you.
So
thank you for having me. Thank you for coming. Is this working? Can you hear me okay? Can you guys hear me okay? Yeah? Okay, good. So I'll tell you a little bit about myself first before we kind of get started. So I am actually a naturopathic doctor. Are any of you familiar with what that is? I know a few of you probably are. Yeah? So with naturopathic medicine, it is a 4-year doctorate. So it's the idea of getting to the root cause of what's going on with people. Nutrition is one piece of what we do. We also do a lot with lifestyle, herbal medicine, and it really depends on the state outside of that. So Florida is a funny state, as we've all known. So Florida, there's not currently a license for naturopathic medicine. We are working on changing that because as of right now, anybody can call themselves a naturopathic doctor and they're allowed to do that. So we are working very hard on that. It's quite the task, but I'm the vice president for the Florida Naturopathic Physicians Association. So we're hoping to get a license soon. So because of that, I do have a license in nutrition. So that is one piece of what I do. And I work with Dr. Heather Ald. So some of you might be familiar with her. She's a gynecologist. She's been a gynecologist in this area, Fort Myers, for over 30 years now. And of course, I'm biased, but I think she's great. So we worked together since January of 2015. We started with Lee Health at that point, but we're now on our own. So it's Southwest Florida Integrative Medicine, and we're on Colonial Boulevard. So anyway, so I'm going to talk to you all today about nutrition for osteoporosis, some of the do's and don'ts. This is probably one of the top things that we hear in our office is women who are concerned about their bone health. And rightfully so. Many women as we get older, we do tend to get diagnosed with osteopenia and then osteoporosis. So we are going to chat about that. So a little bit about bone health. We're not going to go too deep into this, but super simply, as far as some of the cells that are responsible for what happens with our bones. So we have osteoblasts and osteoclasts. So they both have two different roles. One is for bone building and the other one is for bone resorbing, because they're supposed to be basically like a recycling effort to make sure that your bones stay nice and strong. That's a good piece of maintaining good bone health. So in order for you to prevent bone loss, you really need to have a good balance of both of them. You do need your old bone to be resorbed and you need new bone to be formed. So as you all, how many of you have had a DEXA? Probably all of you, right? I think, wait, is that everybody? Yeah, I figured, yeah. So DEXAs, those are the gold standard, and usually it's recommended every 2 years after the age of 50. We get asked a lot, can you do a DEXA sooner than that? If you want to pay out of pocket, you can. But you guys probably have some machines that you use too here, right, for measuring bone?
We have an ultrasound screen.
Very cool. So it's nice. You have a lot of different tools that you can use. And so with the DEXA, you get two different scores, basically the T-score and the Z-score. So the T-score is the comparison of bone density with that of a healthy 30-year-old, whereas the Z-score is the comparison bone density with that of the average person of the same age and sex. So some places will use both of those parameters, some will only use one. But it's important to know those. And the lower scores, the more negative, means a lower bone density. So quite often you'll see that on your reports. So the T-score of -1 to -2.5 is osteopenia, whereas the -2.5 or lower is actually osteoporosis. So we'll often get asked too, are there any other things that you can do to look at bone health? And probably one of the more popular ones that we'll get asked about is the collagen cross-linked N-acetylpeptide, which is a urine test. So that can help to measure the bone resorption. It's not used as often. They'll use it sometimes more with some of the medications that are used for osteoporosis. But we do have some people who still want to check in on that and see if they can measure anything there. So that is an option as well. So let's talk a little bit about primary osteoarthritis. So in this, it is idiopathic, which means that for a lot of people, there's not really one set known cause. And I should actually warn you guys, because I keep like squinting. I had my eyes dilated earlier. So it's I'm struggling a little bit today. This is bad planning on my part. But when you can get an eye appointment, or any kind of doctor's appointment here, you take what you can get, right? So for a lot of it, it is caused by an increase in bone resorption. And the question of whether bone formation remains normal or not is unknown at this point. So it's of course most common in postmenopausal white women, And that's just because white women have histologically less dense bones at maturity, which accounts for the increased risk for white women. And of course, with women, once you're postmenopausal, you produce less estrogen. Less estrogen means less bone. So that's why we tend to see that so often too. And it's almost like, in our office, I should say, Dr. L is a gynecologist, so we do see men, but we do mostly see women. So of course, with our patients, we do mostly see women who are concerned about their bone health. So it's extremely rare for us to see somebody who doesn't have osteopenia or osteoporosis. It's extremely rare. So there are, of course, other factors of development of osteoporosis. These are some of the more common ones. Malabsorption of intestinal calcium. So this is people who they're eating what they should, they're doing their supplements, but they have some sort of malabsorption issue. It's common with like celiac disease, IBD, sometimes like an IBS. An IBD is like an inflammatory bowel disease like Crohn's or ulcerative colitis. Vitamin D deficiency, this was not talked about as much in the past, but luckily it's talked about a lot more. Are you all familiar with your vitamin D? You have that checked? Good, I see a lot of head shaking, yes. It's very good. Little muscle mass, this is another big one. This is like a pet peeve of mine because as women, we're kind of taught to shift more towards cardio, like even like, right? How many times have you heard like the push towards cardio and not much towards strength training? So that really, I think, goes against us so much. And anytime we have women who lift weights or do any kind of strength training period, I just get so happy and encourage it because it's extremely helpful for us. And our bones is one of those places where that is the case. History of smoking cigarettes, that is another big one. With people who smoke cigarettes, they do have more bone loss. Use of heparin and some other medications, which we'll kind of briefly discuss too. Failure to maximize bone mass during young adult life. And then, of course, a sedentary lifestyle. So we know that having a sedentary lifestyle is not good for anything, you know, so that's obviously going to be a huge one. Some other factors for development, thyroid and parathyroid disease. So we have a lot of people who have thyroid or even parathyroid conditions that can affect your bones. We see that actually a decent amount in our practice. Kidney disease, excess alcohol, and then, of course, excess vitamin A, caffeine. Did you guys know that one? But who still loves their caffeine, right? Guilty. Excess soda, and then inflammation. So that's one that I think that kind of goes under recognized, the inflammation factor. Inflammation, as we know, it's really kind of the cornerstone of many chronic diseases. And we tend to not think of it as much for bone health, but it is just as important for bones as it is for other pieces too. This is just an example of some medications that can increase your risk for osteoporosis. So it's a pretty decent list. Prednisone, which I think probably almost everybody's been on prednisone at some point, but this is more for people who are on prednisone for long term, like autoimmune conditions. That tends to be a big one. Some breast cancer drugs, prostate cancer, heartburn medications, blood pressure, diuretics, SSRIs, heparin again, and then long-term use of Tylenol. And we have a lot of people, again, in a lot of pain. They're using Tylenol or some other over-the-counter medications a lot. But to kind of put it simply, it's a bone resorption disease that is not painful until a fracture occurs. So most people have no idea that they have osteoporosis or osteopenia until you actually, either they don't get a DEXA and then they get a fracture, or they actually are told that at their scan. So this one's a big one. It's a little bit wordy, but I think that for all of you, this probably is like a duh moment because you all care, you're here, you know, you're at a place like Osteostrong, you're doing something about your bones. But I think as a whole, we don't do a good job really of letting people know why it's so important to do something about your bone health. We tend to think, oh, just you'll go on the medication if it ever comes to that. But really, why do we care about this? So a woman's risk of fracture is equal to her combined risk of breast, uterine, and ovarian cancer. That's a combined risk. A man is more likely to break a bone due to osteoporosis than he is to get prostate cancer. And then some of these, I think these ones really hit at home. 24% of hip fracture patients age 50 and over die in the year following the fracture. 6 months after a hip fracture, only 15% of patients can walk across a room unaided. And the last one, every year, of nearly 300,000 hip fracture patients, 1/4 end up in nursing homes and half never regain previous function. So this is a good example of why it's really important for us to really care about our bones and our bone health. So I have to tell you guys, so Dr. Auld had a talk that she had put together, and this one's from hers, the next few are from her. I have to add that in there. It can't be plagiarism, right? So this is a quick little true or false. If bones contain primarily calcium, it is logical to assume that taking a calcium supplement might prevent bone loss. False. So a little bit about calcium. So these are a few studies that were put together, kind of like a summary of them. But in 2007, a study from the American Journal of Clinical Nutrition, they found that women taking calcium supplements do not reduce hip fracture risk and may even increase it. This is also from the British Medical Journal. 24,000 men and women taking calcium supplements had a 139% greater risk of heart attack. And then there was a 9% increase in death from all causes in calcium supplement users. JAMA, 12,000 men and women who took over 1,000 milligrams of calcium supplements per day increased the risk of death by cardiovascular disease by 20%. So this, it kind of really makes you wonder, like, why is calcium pushed so much? I will say that when you look at studies, I don't care what study it is, you can find a study that's pro for whatever you're looking for or anti for whatever you're looking for. For a lot of these, we know calcium is still important. This doesn't mean never use calcium. But again, this is one of those things where it's A, make sure you're doing the right form of calcium, B, the right amounts, you're doing everything else correctly. And 2, there are people who, if they do have certain risk factors, they shouldn't be taking calcium. So it's, again, you can find studies to do pro or con, but just keep that in mind that it's not just do it and forget it. So let's talk about milk drinkers and osteoporosis. Who grew up drinking milk all the time? I know I did. I see some shaking your head, no?
No, I was lactose intolerant.
Oh, you're actually lucky. That's a good thing. It's a good thing. Everybody else milk drinkers though? I did. I grew up mostly in like central New York, and you're surrounded by dairy farms. It's what you did. I drank milk all day, every day. Can't tell you the last time I did, but I did all the time. So this is looking at galactose in milk, this study. So galactose is, just as you would probably think with the tose at the end, that is a sugar. So 100,000 men and women followed up for 20 years. So what did they find when they were looking at milk drinkers? Milk drinking women had higher rates of death, more heart disease, and significantly more cancer for each glass of milk. So see, you were lucky from not being lactose intolerant. So 3 glasses a day was associated with nearly twice the risk of death, and they had significantly more bone and hip fractures too. So for some things with milk, we do know that it can increase your risk for high cholesterol, heart disease because of the saturated fat content in it. But it's interesting that actually milk has a negative effect on bones in some studies. So experimental evidence in animals suggested that the D-galactose, which is a sugar, is associated with aging and damage to tissues at a cellular level. So this might be why it's a negative effect on bone health. So we always talk about, obviously, getting everything through food is always going to be best. So this is one of our little cheat sheets that we always give out for non-dairy sources of calcium. So you don't need to eat calcium. You don't need to eat anything like dairy products in order to get your calcium. So it's kind of like a little chart there. Dried figs have quite a bit amount, and 10 figs. Salmon, that's a tiny amount of salmon too. White beans, spinach, turnip greens, soybeans, broccoli, almonds, bok choy, they all are full of calcium. And then I like the list at the bottom too. Those are different foods that inhibit bone resorption, so they prevent your body from kind of stealing more from your bones. I like that list because I personally love garlic, rosemary, parsley, dill, onion, and so on. So there's a lot of different foods that you can eat in order to make sure that you're keeping your bones healthy. And it does not have to be dairy. I will say, does anybody, like when you hear no dairy, does that make you mad or sad? Yeah? Some of you? I'm not kidding when I say for people in our office, when we talk to them about limiting dairy, you will never see a sadder face, especially with cheese. People love cheese. I always feel so badly. People look at me and like they're devastated. Like, I'm so sorry. So again, some other complications of absorption. Celiac disease, which is quite common. I think it's underdiagnosed. Bariatric surgery is another one too. Crohn's disease, and then other causes of malabsorption. We have a lot of people who have things just move through them very quickly. If things are moving through you too quickly, you're not going to absorb as much of anything as you should be. So then again, when we talk about calcium, again, to say that you don't need calcium would be very bold and incorrect. So you do need calcium. It's always preferred first to get it through food, like the non-dairy sources we talked about. But then if you are going to take a supplement, Plant-derived really is preferable. There's a lot of algae-based calciums out there that are pretty well tolerated. Keeping in mind too though, your body can really only absorb about 500 milligrams of calcium at one time. So a lot of the products over the counter have like 1,000 in one pill. So your body's really not going to utilize that very well. So we'll usually do more of a 500 milligrams twice a day type of scenario. It's best if you take it with other cofactors for bone, and we will talk about some of those too. And then when you're taking it, make sure you really try to avoid caffeine and sodium because that can make you excrete more of it out. You're not going to absorb it as well. And one of the questions that was on here too is talking a little bit about different foods that can block absorption of different nutrients. Are you guys familiar with that? I see a couple heads shaking yes. So the two most common things you'll hear about usually are phytic acid and oxalates. Does that sound familiar? Yeah, so a lot of people recommend to avoid these types of foods, which really these are really healthy foods overall. There's some grains, there's some nuts, seeds, legumes. Really, when you look at it, it's not too much of a concern when you take it as a whole meal and have it all broken down throughout the day. So both phytic acid and oxalates, it's not really a realistic concern to be too worried about when it comes to eating those foods. There are certain things that you could do though to neutralize that aspect of them. So like phytic acid, actually both of them, sprouting, soaking, fermentation, and again, dividing out the doses can really help. And then with oxalates, if you add vinegar or lemon juice, you can really help to neutralize oxalic acid, which again, that helps too. And of course, another one, vitamin D. We kind of briefly talked about that, but vitamin D is necessary for absorbing calcium and it is responsible for bone mineralization. Really getting it through the sun is by far the best way to get your vitamin D. Of course, a lot of people feel conflicted because then your dermatologist gets mad at you, right? We're trying to avoid the sun. But really only 15 to 20 minutes. You could do that like once a week. We usually tell people aim to get your full back exposed. So either bathing suit or a low cut, like tank top, something like that, without any sunblock or anything to block the production of vitamin D. That's really the best way to do it. There's also other benefits to being in the sun too than just vitamin D. So it's a really nice way to add in some kind of like self-treatment time too during your week. A lot of people, when they're taking vitamin D, they're either taking way too little or way too much. So are all of you, do you know what your vitamin D levels are? Yeah? Good job. You said 50 something, that's a decent amount there. For a lot of people, they'll come in and it's like in the hundreds. We're like, please stop taking it because it is liver toxic. So you can get too much of a good thing. So again, just make sure that you're cautious of that. And when you look at your labs with vitamin D, it really depends on which lab you go to that shows your reference range. I think it's a LabCorp, they're usually like 15 or 13 to 30 is the reference range, whereas Quest is 30 to 100. So it kind of really depends on the lab, but usually like there's a lot of research that suggests like 50, 60 is a good amount to be at without having to be concerned about it being too high. But if you get it through the sun, you really don't have to worry about it. And two, with supplementation, you can have malabsorption. It is a hormone really, and some people don't do well with fats because it has to be fat soluble. So it's another thing to keep in mind, another reason to be in the sun. Vitamin K, you're all familiar with vitamin K? Yeah. Good. So vitamin K increases bone mineral density and it does reduce fracture rates. Vitamins K and D, they really work synergistically and it helps to drive calcium to the bones. That's why a lot of the bone-derived supplements have vitamin D and K together. That's really one of the best ways to do it. And when you're looking at vitamin K, there are, with all nutrients, there's multiple forms of that particular nutrient. So with vitamin K, the two that you're going to see the most, vitamin K1, K2. With the bones, it's really the K2 that's the biggest factor. So people who are vegan or vegetarian, they might not be getting that as much. But again, that's a good supplement. We'll have that in there for bone health. Magnesium. This is one that a lot of people are on because there's a lot of benefits to magnesium. It does increase bone density and it helps prevent onset of osteoporosis. Some good food sources, leafy green veggies, legumes, nuts, seeds. Do all of you eat all that stuff? Yeah, that's very good. So supplements, this is one of those that you really have to be cautious of the form and the amount. So are some of you taking some magnesium? Anybody out there? Not by itself? In a mixture, yeah. So with magnesium, you're going to find a lot of different forms of magnesium. Over the counter, the two most common forms are oxide and citrate. If you have constipation, magnesium oxide and citrate are great. If you don't, you're going to be running to the bathroom. So be careful. There are different forms of magnesium that are much better absorbed without having that as a side effect. So just keep that in mind. We really don't ever recommend oxide. Like I said, citrate, we'll use it for constipation, but that's it. But glycinate is a much more preferable form. It's easier absorbed. And there are other forms too, but again, over the counter, avoid the oxide, citrate if you need it. Phosphorus, this is another one. Usually you're going to find it in a good put together supplement for bone health. It does work with calcium to build your bones, but high phosphorus with low calcium actually has a negative effect on your bones. Again, that's why it's really important. So if you are taking a supplement, it's very well balanced and you're getting it from a reputable place. And then of course some food sources, chicken and turkey, seafood, sunflower, pumpkin seeds, nuts. You'll notice that a lot of these are similar sources, right? So if you eat certain foods, it's much easier to be able to get a lot of these through your food. Collagen, how many of you are taking collagen? Or you've heard about people taking it, swearing by it? Now collagen is really popular for the last few years or so. And there is studies to suggest that it is beneficial for bone mineral density. One study actually showed after collagen use for 12 months, there was a significant increase in bone mineral density. So it is science-based. It's kind of weird because sometimes with collagen, it doesn't get absorbed as collagen. People tend to kind of think of that, but it's the breakdown products that are actually really beneficial. And they do think that collagen peptides may actually boost calcium absorption, and it can actually help to inhibit some bone breakdown. So again, some people are breaking down bone too much, so this can really be helpful. And a lot of people swear by it for their skin too, so that's a perk, and for GI health as well. But this is one too. I have to say, just again, when it comes to if you're buying something, be very careful. A lot of companies don't test their products, so you don't know if it actually is tested to not have heavy metals. A lot of the stuff over the counter really is not great, to put it lightly. So you just have to be very careful with what you're taking, and collagen does tend to be one of those that has heavy metals. So sources of collagen outside of that, bone broth. I can't bring myself to do bone broth. I tend to be more vegetarian based, but some people love it and good for them. Fish with the skin, same thing, can't bring myself with that. But chicken, and then of course some vitamin C rich foods. I'll stick with those. Blueberries, bell peppers, tomatoes, leafy greens. Bell peppers actually have some of the most vitamin C of any food. So make sure you're adding all those into your diet. And then so a few other minerals and elements that people take. For all of these, there are studies that show that they can be beneficial, but some studies too that show that they might not be, or they might actually cause harm. So it's one thing if you are, going to take them, make sure you do them in minimal amounts. And some of them have really long half-lives, so they're not cleared out of the system. So just be cautious with all of those. So some natural treatments for osteoporosis. This was a Dr. Old one too, and I liked it, so I left it in here. I especially like that picture. That was a really good one. But in older women, doubling the fruit intake is associated with a 5% higher spine mineralization. That's a good amount. So again, eat your fruits and veggies, especially your fruits here. And cellular studies demonstrated that olive polyphenols enhance proliferation of pre-osteoblasts, differentiative osteoblasts, and decrease the formation of osteoclast-like cells. So this is your olives in itself, and then olive oil. So making sure you're getting a good amounts of those is extremely beneficial. How many of you know the prunes almonds combo? If you've seen Dr. Ald, you probably do. She loves to talk about this one. So there are studies showing that eating 12 prunes a day for 3 months showed the highest marker for bone formation. It's a lot of prunes. You're not going to need that magnesium citrate at all, but that is a lot of prunes. But especially too, and it's paired with almonds. So almonds showed most help preventing bone breakdown. So if you eat them together, there's actually a really great benefit for bone health. And I will say again, with something like this, you don't know the size of people eating the 12 prunes. Maybe these are bigger men or something and they need more prunes, and sometimes a smaller frame woman might not need exactly 12 prunes. But it's interesting that the two together work so well. It is a lot of sugar, yeah. But when you're having something you have to kind of balance things, so if that's your sugar, that's really not that bad. And then to anything, as long as it's paired with fiber, it's much better for you because it's going to slow down the glycemic boost of sugar. But I really would like to see the amounts of the sizes of the people they're looking at, because it could be very large men, and that would change things. But all in all, common sense really goes a long way when it comes to bone health or any other kind of health issue. Eating all varieties of fruits and veggies to increase antioxidants, because those have been found lacking in women with osteoporosis. And the antioxidants are thought to downregulate osteoclasts and upregulate the osteoblasts. So it helps to really improve the balance of those two working together. And really eat a balanced diet. You can't go much more complex than this. This is a picture of just the anti-inflammatory diet, which is basically the Mediterranean diet. The Mediterranean diet has been studied year after year to be one of the best diets out there for a majority of people. There's not one diet that's perfect for every single person out there, because people have different health risks, different family histories and things like that, but really when it comes down to it, eating real food is going to get you very far. So eating your fruits, eating your veggies, beans and legumes. This is, like I said, the anti-inflammatory diet, so it's much more minimal on animal products, but it does still have some eggs. Fish is a big part of this one for the healthy omega-3s, whole soy foods. But again, the Mediterranean diet, you can't go wrong with it, and there's a ton of sources online where you can find different information about it and recipes. And this is one thing that's very important. Don't do harm by trying to do good. So what does this mean? Thyroid medication. This is one that is probably a pet peeve of mine, because we tend to get people coming into the office who want to lose weight, so their doctors will put them on a thyroid medication when they don't really need it. So this is not good for you for multiple reasons. But one of them is, if you're on too much thyroid medication, it can cause bone loss. So a lot of these people, of course, tend to be women, and then they're just increasing the bone loss that we're already up against. So please be cautious of that. Don't go on a thyroid medication just for weight loss. If you need it because you have hypothyroidism, that's a different story, and usually it's going to be well balanced and you're not going to have that problem. Hormone replacement therapy. This is another big one. Again, we're a gynecology office mostly, so we see a lot of women for hormones. So it is definitely true that hormones can help with your bone health, especially estrogen. You have to make sure that if you're a woman, you have not had a hysterectomy, that there's a balance of progesterone there as well. And to make sure that the estrogen levels are not too high, because that actually can convert over to bad estrogen. Taking estrogen orally can increase your risk for blood clots, strokes, things like that. So it always has to be very well balanced. And then we have some people who are on hormones for bone health, and the levels that they're on are just through the roof, like even estrogen, testosterone, all of them. The high testosterone also puts you at an increased risk for cardiovascular disease. We've had people who've had to go donate blood because they've come into our office and their testosterone levels are through the roof, and their hematocrit and hemoglobin are too high, putting them at an increased risk. So if you do go on hormones, it's a fantastic tool. It can make a world of a difference, but the key is to make sure you're going to somewhere that is going low and slow and making sure it's very well balanced. Dr. Ald actually was involved in some of the original studies on estradiol numbers for bone health. So I think that's pretty cool. Because when you look at your estrogen levels, especially the estradiol, that's the good healthy estrogen, if you're on hormones for bone health, it really has to be around 50 in order for it to be beneficial. But it does not have to be 350. That's not going to make it that much better. It really puts you at an increased risk for other things. So just make sure it's well balanced. Too little calories. So if we don't eat enough food, and again, women, we tend to fall into these categories, especially as we get older, our metabolism slows down, we tend to eat less. That actually is going to make you have deficiencies in your nutrients. It's going to eat away at your muscles, and it does put you at an increased risk for falls and fractures and everything like that. So make sure that you're eating really well. And if you're struggling with that, see a nutritionist. There's a ton of them out there that can really help. And then, of course, just taking the medications alone. So these medications, in the most part, they're built for shorter periods of time. They're not meant to be on forever, and people tend to stay on them too long. If any of you have been on them, you'd notice that the dentist, you have to sign your life away, saying that if you have a fracture or a break, that it's not their fault. So just, again, be cautious of it. They're meant for a short period of time. Sometimes maybe you have to go on them, and that's okay. But look at your other options too, and make sure you're doing everything else as well. Especially to exercise and everything that you do here. That's very important. There's a huge piece to it. And the best advice is get a dog. They make you walk every single day, and they'll help with your bones. Because as you know, with swimming, you're not going to get as much of a benefit. You really need that harder pounding, that resistance that's really going to help to build. And I think everybody should adopt a dog. They make you happy. So that's another piece. Does anybody have any questions? Come on, somebody else have a question. Yeah.
Do you have any insight into Algae Cal?
Yeah. So the algae, you mean the company Algae Cal?
Yeah, and then
I'd have to look at it again because I don't remember off the top of my head. So when it comes to supplements in general, we don't pick just one brand or like two brands or anything like that. We look for GMP or USP. So that usually designates that it's a higher quality product because there's an outside company watching them and making sure that they're doing things correctly. Outside of that, I would have to double check to see their product as far as if they are GMP or USP. Just because it's not, it doesn't guarantee it's a bad product, it's more you don't know. But in general, I do like algae-based calciums much more than just a regular one. That's a good question.
I take
Yeah.
vitamin D3 and K3, I can't remember, 5,000 units a day. Do you think that's too much?
So I can't answer that entirely because that would be like personal advice, but I can say 2,000 IUs is usually a good amount for like a daily, everyday kind of person. But if you had your blood work checked by your doctor, then they can give you better guidance as far as if you need more or less. Just depends on your blood work and everything. Yes.
So what percentage is hereditary versus lifestyle versus bone size?
Yeah, that's a good question. So I don't know the exact data on like the breakdowns of that, but those are all important factors. Obviously, if you're more genetically predisposed to having osteoporosis, that's going to be a big factor. And two, a lot of women have smaller frames. So if you looked at you when you were like 30, maybe you would already look like you had osteoporosis or osteopenia maybe, or smaller bones and density. So that is an important factor that I think doesn't get looked at enough. And they are important. I mean, it's still important to make sure that your bones are nice and healthy and strong as strong as they can be, but those are really important factors. I wish I knew the breakdown better of the percentages, but that's a great question.
I mean, I've been working my whole life trying to get them stronger, and it's
I know, right? It's so true. It's so true. I think, I'll tell you what, being a woman, I think is one of the hardest jobs. You're fighting at every single point and things that are just easier for men. And men tend to be bigger. You know, they tend to carry around a lot more weight, so they don't have as increased risk of that too, which is a big factor. Women tend to be much smaller builds. So it makes it, again, another factor for us that we have to fight against.
And what is your what do you think about rebounding?
You know, I don't know as much about that one.
Okay, 'cause
You guys might. Yeah.
I've read that supposedly it's supposed to be.
Yeah. What is your?
Yeah, so rebounding on the rebounder
Yeah.
eliminates the hard impact that
Yeah.
you need. So all of the studies for bone density,
Oh.
you say you have to have hard impact and
So it's the
ground reaction forces
opposite.
going up your skeleton. So rebounder eliminates that.
Okay.
It's good for the lymphatic system,
Lymphatic,
cardiovascular,
Yeah.
but not bones.
But not bones, okay.
Yeah.
I knew you'd know the answer to that.
And I was doing it for the lymphatic, not for bones. Okay.
Yeah. Yes.
one of the things you mentioned was excess alcohol. But so what's a normal amount that would not be harmful?
You know, really though, alcohol, I mean, listen, we all love our glass of wine here and there, but alcohol is pretty horrible for us, you know, so really limiting it to one glass is, even that I think is, quite honestly, I think that even that's generous to say 1 glass a day of alcohol, because it really is just not beneficial for us. You know, there's so many I mean, yes, you know, the resveratrol, but it's empty calories, it's sugar, it's dehydrating, you know, it's just not great for us. So limiting as much as possible, I'm a big proponent of. Not to say you can never have it by any means, but really trying to minimize it. And most people find that they're really doing it more out of habit than anything else. You know, they're not even drinking it because they want the alcohol aspect, it's just a habit. So once you find a different way to replace that habit, it's so much easier. I know, that's always a tough one too. Wine and cheese, those two. Those two are tough.
I just drink my iced tea out of a wine glass.
It makes a big difference. Little things like that can make a really big difference. Yeah.
Makes you feel.
My newest thing is, well, not newest, but I remember in school, we had a professor who loved kava. So that always makes me think of that. Sometimes I'll get kava and make myself a little like kava cocktail, and I feel like I'm having something special, even though it's not much, but still, I think it is, so. Any other questions? Yes.
What about goat milk?
Goat milk. So goat milk does tend to be tolerated better, but I don't know if they've looked at it study-wise as far as the calcium aspects of it. But goat milk does have different proteins in it, and it does tend to be GI-wise a lot easier for people.
And cheese too.
Same thing. Yeah, same thing with cheese. With a lot of dairy, it's the saturated fat content. So that's a big piece to look at. So, I mean, and there are some people genetically who they cannot have over 20 grams of saturated fat a day, which is not a lot of saturated fat, or else it'll really increase the risk for cardiovascular disease, and they'll gain weight really easily too. But there are certain things like the 23andMe or some of those other ones, or even I think now Quest has some labs where you can add in like some of their genetic profiles, like ApoE4 it's called, and you can see a little bit better where you fall into that category. Any other questions?
Dr. Spano, we had some questions typed up.
Yeah.
From somebody who couldn't attend. I'm not sure if they were already asked.
So the first one is, does it matter the order/time of day I take my supplements? And that is yes, but it really depends on the supplement. So that's a huge factor there. And what is the correlation between leafy greens such as kale or spinach and calcium absorption? It's the same thing with like the oxalates and the phytic acid. It doesn't really end up being too big of an issue. And then do you have any recommendations in certain foods that'll help with retaining and calcium absorption? That's funny. So that's like our non-dairy sources of calcium. So that list actually is perfect for it. Which if you, you probably have email addresses, right? I can send it to you guys if you want, if you just let them know. Okay. I don't mind emailing that out to you. Like I said, we use that all the time. That's our little cheat sheet for non-dairy sources of calcium. Any other questions? Yes.
The naturopathic doctor, Michael Murray, I'm sure you know of him, he talks a lot about BioCell. It's very important for bone health. What's your take on BioCell?
I'd have to look at it again, because that's a product, right? Like an actual like product with different, it's a silica blend? Yeah. I'd have to look at it again, because I don't remember off the top of my head. I'd just have to look at it. Any other questions? Yes.
Yeah, I've done a lot of reading, and I read that you have to make sure that you have enough protein and throughout the day in order to build bone. Is that, I didn't see that mentioned a whole lot.
So protein, it's funny because there are some studies show that excess protein is actually a bad thing for your bones, and there are studies that show the other. But really when it comes down to all of it, it depends on you and how much protein that you particularly need. But protein, just like any other nutrient, is important for bone health and everything else for that matter. And so if you don't have enough protein, you're not going to build muscle. Same thing if you don't have enough calories, period. But that's an individualized one. A lot of people, especially Americans, we tend to get actually ample protein. Women probably not as much as mostly men. But that's one, it's, I like some of those apps like, what is the name of it? The one where you can track everything you're eating for a few days, and it lays out how much protein in particular that you're getting. And you put that with your size and what your exercise components are, and it gives you a better idea of how much protein that you need. Because excess protein is hard on the kidneys, especially as people get older. You're really too young for that, but especially as people get older, especially excess animal protein is really tough on the kidneys, and it can cause kidney damage. Vegan sources of protein don't have that same negative effect on the kidneys, but again, it's just one of those things to look at your particular diet, your activity level, what your goals are, and then making adjustments here or there. You're welcome.
MyFitnessPal?
Yes.
Yes.
I knew it was kind of come to me. I like that one a lot because I think it's, I mean, it's kind of annoying, honestly. If you eat well, because you have to plug in like one carrot, you know, like so specifically, but it's really good to do for a few days so you get an idea of what your nutritional profile looks like to just kind of see like what you're doing and how you're doing with that. It's such a good way to do that. And it's free.
MyFitnessPal.
It's free still, right?
Yeah, it's free.
Yeah.
Yeah.
There's the one on My Pyramid.
Oh, I'm sure there's a ton of them out there, yeah. Any of those that you can track easily, they make it so simple. But that is a good one, because I mean, women, I think we really do tend to undereat. You know, we have a lot of women, we have them fill out a diet diary, and a lot of women really are under eating, even if trying to lose weight, because it's, you know, so just make sure you do something like that, or talk to a nutritionist or anything like that. Any other questions? Yes.
Does your practice prescribe bioidentical?
Yes.
Do you run saliva or blood?
Both.
You do both?
We do.
When do you distinguish between what?
It depends on the person, and it's more so we stick with one over instead of flip-flopping. So if you've done blood for hormone levels, then we'll stick with blood. If you've done saliva, we'll stick with saliva. Sometimes too, it just depends on insurances. Some Medicare, for example, it'll go directly through with the salivary testing company we use, and they won't pay a penny. And some people's regular insurance won't cover hormone testing. So it really just depends on the person and making sure we're consistent with that. Because you really can't compare blood and saliva levels. But some of the salivary testing is a little bit limited with you can't get everything that you can order through blood, but it's still a good tool and we use it. Any other questions?
Do you guys often test any like blood biomarkers in your office to see if someone is in like a bone building state, or you guys go mainly off of the DEXA?
We go mostly, we will in some people who request it, but sometimes with insurances not covering, we try to take that into consideration, but usually we'll go with the DEXAs, and because you do have to give it a good amount of time to see improvement anyway.
Right.
But between all that, it just depends on the person and what they really want to do. We've had a few people request it, not a ton want to do it though.
What is a good amount of time between DEXAs? I mean, I know you said 2 years up here, but if you're working on and doing a lot of different things.
You
want to
might
see
know
it.
better actually. Do you have any recommendations for those? I mean, usually you do have to give it a decent amount of time in order before you're going to see a good result. We'll usually tell women if you want to pay cash, you can do it like once a year or something like that, but what do you guys recommend?
You can see, people see first changes in 6 months, but that's how long it takes typically.
Yeah,
Both
it's not
slow
quick.
metabolic. But
Yeah.
the older the person is, usually the longer it takes. So a year is a happy medium to really see a significant enough change. But people have seen from 5 to 14% improvement in 6 months. So we usually recommend 6 months to a year.
Yeah.
It's usually self-pay, and you
Yeah.
can, if you pay cash, it's not that expensive. There's a lot.
Yeah,
of
it's really not
places
that bad.
Do it for $50 to $100. So you just need a doctor's prescription though, because it is a radiograph.
Yeah, that's when patience is key. It's a tough one, but usually for our patients, we'll tell them don't do it more than once a year because you'll drive yourself crazy too, because it's just such a slow mover.
Is there a heel measurement that is also used?
So a heel measurement is also an ultrasound measurement, and it's you can do that on the heel, on the fingers, or the forearm, and that's a great screen. So it would give you a general T-score, a general Z-score, but if you really are looking for a diagnosis and also comparing data, you've got to get a DEXA, because that's the gold standard for the spine and the hips. That's how they really, really can be certain that either you're improving or not. So screening tools are not a great tool for measurement. It's a great tool to detect something if you had no idea what your bone density is.
Any other questions? Well, thank you all for coming and having me here and being patient and listening. Thank you. So I can send that non-dairy calcium if you want.